In this episode of our Small Business Spotlight series, we sit down with Becca Rose from Wisconsin Myofunctional Therapy. I want to mention that in the video, we mentioned the business being called Myofunctional Pathways because at the time that we recorded this, that was their name. But since then, they've done a complete rebranding to Wisconsin Myofunctional Therapy just to be able to encompass more of what they're able to do because she has multiple locations, both up in the Green Bay and Appleton area, as well as down by Sheboygan, Oostburg, and has the capability to serve virtual appointments. So now really opened up to all of Wisconsin and beyond. So basically, Wisconsin Myofunctional Therapy is the new name, but if you hear me mention myofunctional pathways, same thing, all right? So watch the video, enjoy, and let us know your thoughts. All right. Well, thank you for joining us and welcome to this new Small Business Spotlight. This time we have one of my all-time favorite people, Becca Rose from Myofunctional Pathways. She is a myofunctional therapist with offices in Oostburg, Wisconsin and De Pere, Wisconsin, and basically is able to service most of Northeast Wisconsin. So without further ado, thank you, Becca, for joining us. And why don't you kind of tell us what you do?
Yeah, thanks, Travis. Thanks for having me. Yes, as you mentioned, my name is Becca. I am a myofunctional therapist. And since most people haven't heard that term before, let me just give a quick rundown of what that is. Myofunctional therapy is a muscle program essentially that's working and targeting on the muscles in the face, the mouth, the tongue, and that helps with a very wide variety of symptoms. In children, we might see things like grinding teeth or open mouth breathing, open mouth posture, snoring, bedwetting. Through adulthood, sleep apnea, TMJ, clenching and grinding. So we're essentially using all the muscles that are in the face and the mouth to do the jobs that they're supposed to do. And then that helps with the symptom control.
All right. And that's a wide variety of things. Can you kind of explain how you landed in this? Because you didn't always do this, right? There was a time before. How did you fall into myofunctional therapy?
Well, I've been in the dental environment for 20 plus years. And about 8 years ago at an office I was working at, I was actually working in oral surgery at that time. Someone came in and did a lunch and learn about this. And I'm like, what? So with my background as a dental hygienist and my licensure, I was able to go on and get additional training to be able to do myofunctional therapy. So once you start hearing about the symptoms and you start putting the pieces together, you go down that rabbit hole and you think about yourself, your child. Oh, I have my mouth open all the time. I'm snoring. I had sleep apnea at the time. So all the little ding, ding, ding bells went off and like, this is something I need to pursue. So really it was things I was seeing in myself. And then things that I could correlate to family members that really drove me down this road.
Yeah, and that's perfect. With that, as you mentioned, not many people know what myofunctional therapy really is or haven't heard the term before. And you just explained to us kind of what it is and what you do for people. Is there a specific type of client that you prefer to see or service, or is it something that anybody could kind of benefit from?
Yeah, that's a great question. Really, anybody can benefit from this. I tend to start with ages 2 and 3. I don't work with the baby population because that's a whole different specialty of professionals. But in toddlerhood, we can start doing training to help the child learn where to put their tongue, because putting your tongue in a certain place in your mouth is a very big part of this. So we have to learn how to do that. Try to keep their lips closed so we grow appropriately. And then as we get into older kids, tongue ties is another thing too. We're looking for tongue ties because that can affect swallowing and speech and sleeping and breathing. But this goes all the way up to adulthood. So I often have clients too that come with TMJ, clenching and grinding, and they're in their 30s or 40s or older, and they need some relief. They've done all the things, the night guards, massages, all the things. But they haven't worked on actual function. So if we break down that term myofunctional, myo stands for muscle and then function. So we are literally putting the function back in the muscles. And then we work with the elderly population and not even elderly, because I was on the CPAP machine for 15 years, but helping people adjust to their CPAP machine and making that more successful. And in some cases, being able to come off the machine altogether.
Cool, cool. I have one of those myself.
All right, we should talk.
Yeah. I know somebody now, right? You kind of mentioned it already on when I asked you what got you into it, but most small business owners that I talk to, their business is a project. It's a passion project. So with that in mind, if you could be known for one thing, the one thing that you want people when they think of myofunctional pathways, whether it be a message or outside of the technical, the treatment stuff, what's something that you'd want to be known for in the community that just really fills your cup or is part of that passion that drives you with your passion project?
So this can be like clinical related.
Yes.
Yeah. Okay. I really would just love to be known for being genuine and really caring about my clients. I put a lot of work into each person, and there's a lot that happens outside of our appointment that you don't see that makes your coming here successful. So that's really what lights me up, and that's what really makes me happy is that I see these changes in people, and they never thought they could see this improvement. And it's life-changing, and it's life-changing for me too as their myofunctional therapist.
And I can speak to that. We've known each other now for just about a year. I'm gonna say I don't remember the exact day, but I remember it was Thanksgiving week because that was last year was impressionable for me. So we have been working together for about a year, and that's one of the biggest things that has stuck out to me. You're definitely one of my kind of people. I pride myself on the relationships and really trying to help people, and that stuck out to me that you are the same way. So I can really appreciate that, and I was hoping you'd say something like that.
I wasn't sure exactly what you were looking for, but I mean, that's what sums it up. That's what keeps me so invested in this, because any small business owner knows how hard it is to run a business, and you're doing 1,000 different jobs. But that makes me just so happy. And that's genuine.
Yeah, that's what gets us up in the morning and keeps us coming to work, right?
Absolutely.
Well, so with that, we're talking about doing all the things. I'm going to transition a little bit over to some marketing kind of questions because that's what I do and that's what I kind of focus on. And I've known you for the past year, but you were in business before that for a period of time as well. What are some marketing challenges that you found with your business? Things, whether it be client outreach or getting leads or social media, and there's the whole world of things. What are some challenges you've had, and maybe how did you overcome some of those?
Well, in the beginning, when I started this about 4 years ago, I did everything myself, which a lot of small business owners do. I put my own website together. Now, it was not pretty, and the remnants of that still exist, and we're working on that. But I did it all myself. My website, I had to teach myself how to do everything. And so a little bit ago, when I said, as the business owner, you're doing all the jobs, that was one of the major jobs because I'm not a tech person. I didn't know how to do websites. So I had to Google and YouTube everything to teach myself how to do these things. And then social media and trying to learn the tricks of social media and Instagram. Instagram's not my thing. I'm going to age myself here, but we had MySpace when I was an early adult, and then Facebook, and then Instagram came, and it's like, whatever, Instagram, I got Facebook, I'm good. So I had to learn all of those things, and then softwares and forms and just putting it all together. And after about 3 years of doing that, and this is about when I met you last year, I met you because I needed help with my website. I didn't have time I didn't want to keep paying for things on the website, that platform that I wasn't using. So that's when I reached out to you. And honestly, I found you by Google search. I reached out to a couple other local places, and their response to me was, "Oh, we don't deal with your website hosting person." So, and I was kind of disheartened by that. So I'm like, wait a minute. And I don't know any better because I'm not a marketing person. But in my mind at the time, it was, you're a marketing agency, but you don't you only work with one thing. And I know now that that's kind of common, but at the time that kind of threw me off. Like, it's like saying you're a hairdresser, but you only color hair, you don't cut it. You kind of expect a hair salon to be able to do more than one service.
Yeah.
Anyway, so then you came in and you helped me transition things. And since then, we've started working on updating the website, getting new content. You started helping me a few months ago over the summer with SEO, just to make sure I show up, because I can't keep up with those things. So it got to a point now with growth in the business that I needed some help. And I also took on an office assistant to help me with some of the social media stuff as well. So the last year has been a huge relief off my plate with trying to grow a business, knowing that I have a trusted team of people like yourself, and my assistant, who can take on some of those more time-consuming tasks.
Yeah, and that's going to be the way that you're going to find success, I think, is being able to work with other people so you don't have to do all of the things, right? You're a therapist, you're not a social media expert. And that's the long and short of it. Most business owners, I talk to some, they're an artist, or they make candles, or they do roofing. They don't do Facebook and Instagram and TikTok. And it's hard to stay on top of that stuff. It's hard for me to stay on top of that stuff, and it's what I do. So I absolutely get that, and it has been great. And as far as the marketing goes, that was a question about some things maybe that you struggled with. My next question is going to be some successes. And I know already, just from speaking with you and your assistant and the things that we've done, I know some of them. But just being able to expand your reach from Oostburg to De Pere in the Green Bay area, and now the things that I know we've done, has been great. But is there something that stands out for you in your mind from a marketing perspective that has really been successful, or maybe just a breath of fresh air to just relieve some stress?
Oh man, I could talk forever. It's really helpful to see the numbers that you send me, like how things are performing, like how, and again, I'm not technical at this, so excuse my difficulty in explaining it, but because you're taking care of the SEO things for me, we can see the help me out here. We can see the trends, right?
Yeah, the trends in the analytics. Yep.
Yeah, so that's been really, really helpful to see. Because yeah, I can look at Google Analytics myself. Yeah, I can look at my metadata myself, and I do sometimes, but you're tracking it all for me. I'm not going to sit there and go from month to month, or the last 6 months, or the last year. I just don't have time for that. So to be able to see that upward growth, in making sure that I'm showing up with other businesses who offer the same services, it's just been a weight off my mind to not have to worry about it. I know I'm showing up. I know that Google knows who I am. And that's because of the work that you've done. And I've asked you to do a lot of tedious things with updating my locations and things. So it's been paying off.
Well, I appreciate the kind words. It has been my pleasure. Um, Outside of that, we're going to get to some of the feel good questions that I like to ask. And one of them is, knowing where you've come from, where you've been, where you are now, 5 to 10 years down the road right now, if everything aligned perfectly, where would you like to see yourself? That could be anything from expanded, offices, to more patients, to staff, anything. 5, 10 years from now, what would you like to see Myofunctional Pathways become?
I'd like to see it become a recognized, reputable place to get help with these symptoms. That is starting right now. So in the future, I'd like to just have stability where, and you can't ever have predictability when you have a service industry, a service business, right? But I'd like to have enough reach and credibility and reputation that people know when they come here, they're going to get the best service, and that they can depend on it. And that's going to include locations. We have multiple locations already, but maybe being able to staff those locations more full-time, where right now they're part-time, and just having a dedicated staff that I know that I can trust to deliver that same degree of patient care.
Yeah, no, that's perfect. And that's the goal, is to scale for you. That's the goal, is to get you that, like you said, stability that's hard to come by, because you're at the mercy of people calling and needing what you have. So it's not just retail sales. It's people have to come in, people have to look for you. So I think you're on a great path with that, and we will continue to work on it.
And
Um,
to jump back for just a second, though, that's where you come in, because I've seen that grow. I've seen that the statistics go up and the numbers go up. So with the service industry, you have to keep reaching the people. And so that's where I need your help, is to keep reaching the people.
Well, again, I appreciate that. That's what we're trying to do, and it's been working so far. Like you said, we've been doing this since about summer on this avenue, and it's been consistently good so far. So I appreciate you mentioning that. Um, on the same track of the 5 to 10 year kind of question, my secret question that I don't tell you about. If there was one wish that we could grant for you, one thing that if you could have done or be given, or that would just change your life as a business owner, what would that one thing be? Because you never know who's listening. Somebody might be able to help.
Oh, goodness. An unlimited amount of fundage so that I could continue to grow and have services available for people everywhere. No, I don't know. It's a hard question.
That's why I don't give you the prompt. I got to keep you on your toes a little bit.
Yeah.
No, an angel benefactor, someone to come in and pay all your bills would be great, right?
Yeah. Clean slate. Yeah, just a way to keep growing. But those things keep coming. So I guess I'm kind of answering my own question, because as the need arises, the need is provided for. So it's kind of happening as we speak, if that makes any sense.
It's amazing how, as you go through growth and development in different avenues of your life, we're connected in other avenues as well. And as you trust and ask, things just happen to happen, right? The coincidences that aren't coincidence is what I like to say with those.
Absolutely.
Well, oh, sorry, go ahead if you have something to say.
No, I just said absolutely.
Yeah. Uh, so then I guess that kind of wraps up the specific questions that I have for you. How can people find you, though? You have your website, social medias. Can you share what those are?
Yeah, so website is myofunctionalpathways.com. Same thing for socials, myofunctional pathways. If you search that, you'll find me. Is there one extra thing I could mention quick?
Oh, absolutely. This is your
Yeah.
show.
Okay. Just because this is it's a really impactful. And so we talked about if there's a way to grow and things that could help you. I just want to mention that I'm a provider, an approved provider for the Children's Long-Term Waiver Program in Wisconsin. Many people don't know what that is, but it's a Medicaid program that is designed for children who have disabilities. So if you're a family who has this waiver already, you know you have it. So if you've never heard of it, you probably don't qualify for it. But this has given me the opportunity to be able to work with children with Down syndrome, autism, and other disabilities. And it has just been life-changing. So I have approval for 6 counties, Sheboygan, Manitowoc, Fond du Lac, Calumet, Brown, and Outagamie. So if anyone is in those areas and they're needing some extra support for their children that maybe other therapies haven't been able to address, reach out to us, because that's been a godsend to be able to work with that community of clients as well.
No, that's huge. Thank you for mentioning that and bringing that up. Yeah, there's a lot of families that could probably benefit from that. I would agree. I'm glad you brought it up. All right, so myofunctionalpathways.com. That's the website. You're on Facebook, Instagram, anywhere else that you're on socials?
LinkedIn.
LinkedIn as well. All right, and we're just search Myofunctional Pathways and you will find her. Any last comments you'd like to make?
I just want to thank you for having me on your show today, and being able to not just talk about my business, but let people know how impactful your business has been for my business. So thank you for all the work that you do as well.
Well, thank you so much for the kind words again, and I definitely appreciate it. We'll have you on anytime we can put you on camera.
All right. Thank you so much.
All right, thank you. Well, I hope you enjoyed our interview with Becca Rose from Wisconsin Myofunctional Therapy. And if you're hoping to get a hold of her to discuss how she could possibly help you or one of your family members, contact info will be over here in the video. And as always, if you'd like to be featured on a future episode of our Small Business Spotlight series, just send us an email and we'll discuss your project.